Hey everybody, Dr. Scott here with the Therapy Guys. Today we're going to be talking about your rotator cuff and how to tell if you have a tear. So your rotator cuff, also called rotary cup, rotor cuff, rotator cup, and by all sorts of other ways, is actually pronounced rotator cuff, and it's made up of 4 muscles that help stabilize your shoulder. So first muscle is the supraspinatus. This is on top of your shoulder blade, running right along here. Its job is to help with this motion, raising your arm out away from your body and up overhead. It helps move it like that and also helps stabilize the arm bone in the shoulder joint socket. It keeps it there with any kind of motion. So really important muscle up here on the top supraspinatus. Next muscle we'll talk about is the subscapularis. It's on the inside of your shoulder blade, kind of up against the rib cage. And its job is to do this motion, internal rotation. So you're just bringing the arm, twisting this arm bone towards midline, okay? These other 2 muscles in the back are the infraspinatus and the teres minor. So these muscles, they do the opposite motion. They rotate the arm away from midline. We call it external rotation, okay? These 4 muscles make up your rotator cuff. Its job, the rotator cuff's job, is to stabilize your shoulder with movement, okay? Your shoulder joint, it's kind of hard to tell with this little model, but your shoulder joint is a very shallow ball and socket joint, okay? It's not deep like your hip. So it's really shallow, but it's still a ball and socket, but the rotator cuff helps keep that ball in the socket, okay? Helps keep it stabilized, especially with movement. So you can understand that if we have some kind of pathology or injury or tear, something wrong with the rotator cuff, we'll often have movement that we don't want, that can lead to pain, that can even lead to the inability to raise your arm up overhead, because we're lacking that stability that the rotator cuff provides. So today we're going to talk about 3 different tests that we can all easily perform, even at home, that can tell us a little bit about how the rotator cuff is functioning, if there's potentially a tear or some kind of injury associated with the muscle belly itself or the tendon, okay? So with that, I'm going to bring in our gracious arm model. All right, guys, Dr. West has graciously volunteered to be our shoulder model here. So we're going to take him through 3 different tests to examine the rotator cuff. First test, what you'll do is you'll raise your arm up out to the side. This is about 45 degrees from being straight out. So you're going to go straight out, come forward about 45 degrees, and you're going to hold your arm as if you're holding a can of soda. Next, you're going to rotate that can as if you're emptying that soda on the ground. And the first thing is, can Wes even hold that position? Okay? This is called the empty can test. This is testing the supraspinatus, or that top rotator cuff muscle we talked about a minute ago. Now, it's a little bit harder to do by yourself. If you have someone else that can help you, that's a great idea. But I'm just going to apply a little downward pressure on his arm to force him to resist a little bit, really engage that muscle. So if he gives easily, that can tell me that there's, at the very least, weakness associated with that supraspinatus tendon. If he can't even hold the position at all, his arm just drops, he can't even get into it, we might be dealing with something a little bit more serious than just weakness. All right, next test. We're looking at the infraspinatus and the teres minor on the back of the shoulder blade, these 2 muscles that rotate our arm laterally, okay? What we do is just raise his arm up to 90 degrees, and then we're going to take him into maximal external rotation here, and I'm going to have Wes just hold that position. Hold it right there, Wes. And he holds it with no problem. What you would see, or what you would feel if you're doing this at home or you're doing this with someone else, is you take him into that max rotation backwards and they can't hold it. There's like a release forward, or their arm releases and drops even. That's another sign of a significant pathology or a significant damage in the rotator cuff. Okay, last muscle. This is for the subscapularis, the one on the inside of the shoulder blade. So what this test is called is the lift off. So Wes is going to place his hand in the small of his back, just like this. And then I can help him, or he can just try to do it manually, but he's going to try to lift his hand, rotate that shoulder internally to come off the low back. Okay? So Wes, go ahead, lift your hand off the low back. Good, he can do that well. Another way that we can do it is I can just manually lift his hand off the low back and then have him try to hold it there. And what we would see if there is some sort of pathology with the subscap muscle is an inability to keep that lift off the low back. He can't maintain that maximal internal rotation. Okay? Thank you, Wes. Go ahead, relax. All right, so these are 3 tests that give us some insight into the rotator cuff. Just because the position might be difficult, just because you have pain there, it doesn't necessarily mean that you have a significant tear. It could just be weakness. It could just be an injury to the muscle or tendon. So don't go running off thinking you have to get surgery or anything like that, okay? These are just tests to give us some idea of where you might need to work on your shoulder, where some areas that you might want to strengthen, okay? Coming up, we'll have a video about what to do if you think you have a rotator cuff tear, or even just a rotator cuff injury. So stay tuned, and yeah, this is Dr. Wes and Dr. Scott. Thanks for watching. Be sure to like, comment, subscribe. Hit us up with any ideas you guys have or any thoughts about a future video, something that you're interested in. Please feel free to leave us a comment letting us know. All right, guys, always keep moving. Shoot.
Tyler.
Never stop moving.